For 25 years, Dr. Kevin Cooper has been helping people manage and relieve their pain without medications.
I've had situations where the patient's gone through a doctor visit, treatment with one of several painkillers, and I've had patients with 1 or 2 visits and they're done and they're pain-free.
It's not that the Shingle Springs chiropractor is against medication. He just wants to see more alternatives to pain management.
If something doesn't work, don't just keep giving me a different pill, but say, let's try physical therapy, let's try a chiropractor, let's try acupuncture. We as a society have come to accept that pharmacology solves our problems. It may not, it may make them worse.
Dr. Cooper's opinion is not just professional, it's personal.
My wife was in the hospital back in 2014 and had a pretty major surgery done. And while she was in recovery, they were giving her IV doses of morphine. And I talked to the nurse about it. I said, I have some concerns. That's an addictive drug. Do you have concerns about her having problems when she leaves? And the comment was, oh no, because it's being administered in the hospital, there's no issue with it becoming addictive.
That was in the hospital, but when Renata Cooper was released, she took with her a prescription for Percocet, and when that didn't work, oxycodone.
It was a definite need as far as the pain, but I had no idea that it was going to be because I've never taken anything like that before in my life. So it was new to me.
She says what she did not get was information on the risk of developing an addiction.
But the information wasn't passed on to me as to how to deal with the pain medication that I was being given.
Renata was not prepared for just how hard it would be to get off opioids.
And then he reduced me down from, and I don't even remember, 50 milligrams to 25 milligrams down to 10, and then down to 5, until I actually ended up not seeing that doctor any longer.
Her prescription ran out, but her physical dependence remained, and her body was not prepared to go without.
It was almost like it was so painful that I couldn't stand the pain anymore, and my whole body just tightened up and I mean, I can't describe it. It was just painful. And my whole body was shaking, and just, I needed, it's not that I needed it. That's not what I was even thinking about, was the need to have a drug. It was the need to make this pain go away.
Renata was going through withdrawals.
It was horrific.
This is the fork in the road for some people. No more legitimate prescriptions, but an unwanted addiction.
Many times we have people who come through our health centers who have become dependent on medications that they took for a good reason, but they are habit forming. They cause physical dependence.
Dr. Jonathan Porteous runs WellSpace, a community health provider with rehab programs in Sacramento. He supports a more intense doctor-patient relationship when it comes to pain management.
Some of these medications, when they're needed, are needed, but they could be managed differently. So, for example, you could offer someone a prescription and then cycle them back and take a quick look at them or check in with them and see if their pain is continuing.
Both Dr. Cooper and his wife Renata agree.
I've talked to doctors at local hospitals that tell me they are allowed 7 to 10 minutes per patient. You can barely do a decent history in 10 minutes, much less come up with a diagnosis, come up with a treatment plan, and come up with some sort of usable option for the patient that's going to be beneficial.
Something needs to change within the industry, because it can't be just here's candy for you, and that's what's happening. So, which is why we have an epidemic now.
Renata found a new doctor who worked with her to taper off the opioids, introduced her to alternative pain management, and gave her a new non-opioid medication for her chronic pain.
I got lucky. I'm thankful.